Hey guys, it's Sasha and Cole. Today I'm going to be showing you guys how to do a surgery at Maple Hospital, and also I'm going to show you how to take care of your patient right after the surgery at the PACU, right here. So let's get started. If you ever spawn at the front of the hospital, you have to go through this door and then come to this elevator. You're gonna click the second floor, and once you're at the second floor, you're just gonna walk all the way to here and you will have surgery. Or you're gonna walk from this elevator, you're gonna walk all the way here, and then here's surgery as well. You're gonna pass the pediatrics department, but if you're spawned at the locker room, you're gonna have to walk through this door here to the rooms, and then here's an elevator. So you're just gonna go to the second floor, you're gonna spawn here, right here, and right there is a surgery. So here's the surgery. Once you're at the surgery area, you're gonna see this. Walk through the pharmacy and laboratory. Do not go this way yet. So you're gonna walk through here, and then here is a door which says pre-op. So here you're gonna claim your patient. Look, here it's gonna spawn some patients. So let's go claim one. Okay, let's go claim a patient. So let's walk to the pre-op, and then here we have a few patients. Let's get Christian. Hey, Christian. Okay, so it's asking you to go scrub in. So you have to go to the surgery again, to surgery area, and you have to walk to the sinks, and then click on surgical scrub, and then start washing your hands. Once you're done scrubbing in, you're gonna make this weird animation, but that means you have to dry your hands. So it's asking you to go get a blue sterilized towel from the surgical prep table and dry hands. So that means you have to walk to any of the surgery rooms. Obviously they have to be empty, not occupied. So let's see. Okay, this one's empty. So the blue towel is next to the door right here. So just grab it, and then you have to put it on the bin. So yay, we have our hands dried. Now it's asking us to get the surgical gown. Okay, so the surgical gown, it's right next to this little table. It's this one right here. So you just have to wear it. There we go. And then it's asking you to get a mask from the mask box. That's right next to it. So just here. Perfect. Now it's asking you to get some gloves. The gloves are right in front on the other side of the room in this little box. So just put them on and you're ready for your surgery. So now let's prepare everything. Like, you're ready, but we have to prepare the table and all that. So now it's asking to grab a clean sheet from the cabinet. The cabinet's right behind me. It's this one right here next to the door. So you walk to it and then press open, and then you're gonna grab this one right here. It's this one's right here at the clean sheets. So just grab it, and you're gonna walk to the bed and prepare the surgical bed. It's gonna take a little bit. There we go. Prepare it. Now, someone's gonna walk in. Don't panic. That's gonna be your assistant. And then another person is gonna bring in your patient, and your assistant is gonna start to prepare himself and then to prepare everything for the surgery. Like, he just prepared the table, and now he's going to attach the IV, and then he's gonna put on some oxygen to the patient. There we go. Okay, now he's going to introduce himself. Wait, no, never mind. He's gonna grab something else. Oh, okay, he's gonna prepare the bed for where we're gonna make the incisions. Now he's going to introduce himself, and then you have to introduce yourself. So just click E, and there we go. We have to give him a little medicine to help him relax and go to sleep, and that's your job. So you have to walk to, look, right here is telling you to grab the sedative from the closet. So you're just gonna walk to the closet. So that's right here. So just grab it. It's the last one. You have to scroll down, and then you have to bring it to the IV, and then click E. And then it's gonna start automatically putting it in. And then click E again. So it's gonna push the medicine. There we go. Now it's asking us to get the saline flush from the closet. Also, it's down below. It's right here. Grab it, and then go back to the IV and click once, and then push the medicine. Okay, there we go. Now we have to wait for the patient to fall asleep. You're gonna notice because he's gonna close his eyes and then just gonna go to bed. There we go. Okay, now you have to wait until your assistant intubates the patient. That takes a little bit. It's asking to grab a bedded-in bowl from the surgical cabinet. By the way, if you have the things in green, that means that you already have it in your inventory. So if you click on it and you don't get it, on your hand, that means that you didn't grab it. So make sure to click again. And then you're gonna place the ball right here. And then you have to grab the Vitadin bottle from the surgical cabinet. So I already have it as well. Okay, and then bring it back. And then you have to fill it. So let's fill it. And lastly, we have to go back to the cabinet and grab this one's right here. The ones that are next to the IV flush. So this one's. And then you have to soak them in here. Use. And then sanitize their skin. So we're going to start surgery now. Okay, we're going to start making it the incision. So just be careful. To not get a cold blue, you have to be accurate. You cannot shake or anything. If you fall out of the line, you're most likely going to get a code blue. But if you follow the instructions perfectly and you follow the line perfectly, you should be fine. So start making the incision. Perfect. Now, cauterize bleeding. You have to click and let it click like that. And it's going to stop the bleeding. Okay, then again, we have to open the fat layer and try to have precision. Again, the blood, just leave the click on. Clicking on it does not work. You have to leave it like that. Okay, so keep clicking. And then open the muscle. And then again, more bleeding. Okay, now click E. Okay, here you have to click and drag and try to be as accurate as you can. Click and drag and like do the shape. Just follow the shape. Perfect. Okay, he had a tumor. So you're going to grab the tumor and you're going to drag it to where it says drop here. And then again. And then again, click and drag until you're done with all of the dots. Try to be accurate, guys. I'm not being that much. I'm trying so hard, but it's obviously it's a little bit hard. So just click and drag. Perfect. Oh, another tumor. Oh my god. He was dying. Okay. Now we're closing the skin. So we're done. We're almost done. Perfect. Okay, one more. And we're done. Amazing. Now he's going to take him to recovery, which is PACU. So we're going to go there in a little bit. We're still not done. We still have a little bit. We still have to wait until he gets into the PACU. We're not done yet, so stay. Okay, now you have to walk to a trash can. And there we go. And now we have to grab the specimen container from the mayo tray. It's where you put the bowl right here. Just grab it. And then you have to bring it into a tube system, which we have one right next to the PACU, so it can get tested. Look, it's gonna go. Bye. Okay, and lastly, we have to use a computer to sign everything that we just did and to be done. And we're done. There's our XP. We're done. We're done with the patient. Okay, now, to take care of your patient that you just did the surgery, you have to walk to the PACU unit. And then you're just going to claim your patient again. If someone already claims it for you, it's fine. You can do another surgery and like literally come right once you're done and claim your patient. So we have to start by putting oxygen masks. So let's put some oxygen and then we're going to take temperature. Remember, they're still under anesthesia, so they're sleeping still. So that's fun. Okay, let's check heart rate. We're just making sure he's fine. I have not gotten any blue code from here. I'm not sure if we could get a blue code, but okay. We have to sign in and report computers, and then we have to put some saline IV. So let's put some saline. There we go. And then come back to the computer and let's give him some medication for pain med, IV pain med. So the Quickseas med station is right next to where the patients are, so that's really good. So let's just give it to him. And now we have to wait for the patient to wake up. So let's wait. We can sit here. Or you can grab some coffee. We have a coffee table right here. So, oh, he woke up. You will know because it's going to say here that the patient is waking up, so go assess them. So let's come assess him. And you're going to start asking him some questions. Like, do you know where you are? And he will have to say yes. If he doesn't know that, then he's not okay. Now, what's his name? So that we have to make sure that he remembers everything. And then we're gonna ask him his level of pain, which is 4. Okay, that's amazing. So now we have to check the bandage from the incision, making sure that it's fine and it's not bleeding. It's not, so now we're gonna take his temperature again. Good. And then his heart rate, once again. And then we have to check also his blood pressure. So the machine, it's also right in front next to where the Quixis is. And let's just put it here. Use, and there we go. Now he's checking his blood pressure. Oh, it's good. He's good. He's perfect. Okay, now we will have to put it in the computer. And we have to go to the patient side, and he's gonna tell you that he feels a little queasy. This always happens, so you just have to go check the computer, and then it's gonna ask you some antiemetic. So you have to go to the Quixis again and grab some antiemetic, and just give it to him. There we go. We're almost done. Okay, so now it's asking to go to the chart. So go to the computer, and that means you have to go here, and it's gonna say transfer criteria met, no signs of bleeding, stable, no signs of arrhythmia, shock, sepsis, or emergency, no high, whatever. So now another nurse is gonna come pick him up, and he's gonna disappear. I don't know where they go now from here. And you're done. You got your XP, and that's how basically you take care of a PACU patient. But yeah, guys, thank you so much for watching. I really hope you guys like this kind of tutorials. Let me know if you guys want other tutorials on any other of the roles. I've done a nurse tutorial, but I think I have to redo it. But I can also show you how to be a medic, how to be a lab tech, a pharmacist, a doctor, and all of the other things. So let me know, guys, what would you like to see? Please comment down below. Also comment down below your level on Maple Hospital, and if you're about to get the level required to be a surgeon and that's why you're here. Subscribe to this channel. We're almost 2,000 subscribers, and I am so grateful for you guys. Also follow me on my TikTok. I'm gonna leave the link down below, but it's at Sasha on Call. And also join my Discord server. I'm gonna be announcing some giveaways there. We can chat and we can play together at some point. I'm also gonna leave the link to join my Discord in the description and also in the comments of this video. Bye, guys.